Monkeypox has made its way to Central Virginia. The Virginia Department of Health announced the first presumed case in the region today. Thanks for joining us for 8 News at 11. I'm Eric Phillips.
I'm Deanna Albritton. 8 News reporter Ben Dennis is live at VDH headquarters to break down how this disease spreads and how you can protect yourself. Ben.
Eric and Deanna, good evening. Inside the Virginia Department of Health headquarters here in downtown Richmond, officials are reporting 40 confirmed cases statewide of monkeypox, and today the very first one recorded in Central Virginia. I'm told a man, no age given by the VDH, but it is a virus that is prompting some serious side effects and causing the most at risk to get vaccines.
It's still a public health concern.
Fever, swollen lymph nodes, and a rash that turns to blisters and then scabs. Symptoms of monkeypox, a virus slowly spreading across the country.
It's similar to smallpox.
VCU Health's chief of infectious diseases, Dr. Gonzalo Behrman, is among Virginia health officials informing the public about the virus.
It comes from animals, typically rodents, being transmitted to humans. There actually was monkeypox in the United States in 2003.
Right now in Virginia, 40 cases statewide, primarily in Northern Virginia. 32 cases there. The first in Central VA, recorded just today.
Really, the people at most risk are people who have close contact with other people who already have monkeypox.
Dr. Lori Forlano, a top epidemiologist with the Virginia Department of Health, says the virus spreads from sexual and intimate contact, hugging or kissing included, even sharing unwashed clothing from someone with monkeypox. The VDH says 300 vaccines are earmarked for people with close contacts, the only people who can get shots for now.
The next priority is to provide vaccine to people who have a higher risk of recent exposure for monkeypox.
Not available to everyone currently because of limited supply nationwide. So you may be wondering who's next in line to get these vaccines. Who is eligible? Well, the Virginia Department of Health says it's men who have sex with men who have multiple sex partners, sex workers, as well as people who are in areas, venues, if you will, with higher risk of sexual activity. I'm told tonight that those vaccines could be rolled out to those populations next week or the week thereafter. In Richmond, Ben Dennis, 8 News.